So today we want to study briefly about dermatomes and myotomes of the limbs. Okay, so let's begin. So we'll define what a dermatome is, we'll define what a myotome is. We'll look at the embryological origin of a dermatome and a myotome. Then we'll look at how many dermatomes we have in the body. We'll look at the distribution of dermatomes, and then we'll look at the distribution of myotomes. So now, what is a dermatome? What is a dermatome? I want us to focus on this picture here. Just focus on this picture. This is the spinal cord. Okay, this is the spinal cord. This is the dorsal rootlet. This is the ventral rootlet. Now, this dorsal and ventral rootlet will come together to form the spinal nerve. The spinal nerve, a very, very short spinal nerve in front of the vertebral artery in the cervical region. Okay, now this spinal nerve will immediately branch into the dorsal ramus and then the ventral ramus. Okay. The dorsal ramus supplies the skin and also the joint facet. Then the bigger ventral ramus will go all the way to the neck and then the upper thorax to form the brachial plexus. Okay, so what is a dermatome? A dermatome is an area of the skin that is innervated by a single dorsal nerve root. Very important, a single dorsal nerve root. Okay, that arises from the dorsal root ganglion, therefore supplied by a single spinal nerve and a single spinal cord segment. Now, what is a myotome? A myotome is a group of muscles innervated by a single ventral nerve root. Okay, so the difference is that for dermatome is an area of the skin that is supplied by a single dorsal nerve root, but for myotome, group of muscles innervated by a ventral nerve root. Now, I want to look at the embryological origin of dermatomes and myotomes. Now, we know that intraembryonic mesoderm is divided into three parts. The paraxial mesoderm, okay, this is the paraxial mesoderm. Then we have the intermediate mesoderm. Then we have the lateral plate mesoderm. Okay, now the paraxial mesoderm is further divided into somites. So what you have here are somites. Okay, and each somite is divided into a sclerotome. So this is a sclerotome and a dermomyotome. Okay, now the dermomyotome will now divide into a dermatome and then a myotome. Again, the intraembryonic mesoderm is divided into three parts: the paraxial mesoderm, the intermediate mesoderm, and then the lateral plate mesoderm. The paraxial mesoderm will divide into somites. Here are the somites. And each somite is divided into a sclerotome and a dermomyotome. And the dermomyotome will further divide into a dermatome and a myotome. So we say that dermatomes and myotomes arise from the somites, which are divisions of the paraxial mesoderm. Now, you can see the distribution of the dermatomes here. Now we say, how many dermatomes are there in the body? There are 31 spinal nerves. However, we have 30 dermatomes. So which one is missing? So from the picture, you can see that there's no C1. It starts from C2. There's no C1. Okay. The reason is because C1 spinal nerve has no dorsal nerve root. Remember that we said that a dermatome is an area of the skin that is supplied by a single dorsal nerve root. C1 spinal nerve has no dorsal nerve root. It only has a ventral nerve root. Okay. Now the C1 carries motor fibers and a small meningeal branch that supplies sensation to the dura around the foramen magnum. Okay, so take note. Even though we have 31 spinal nerves, we have only 30 dermatomes. We don't have any C1 dermatome. So this is the distribution of the dermatome. We'll look at the upper limb, we'll look at the lower limb, and then we'll look at the trunk. So for the upper limb, I want you to remember three even numbers: number 4, number 6, and then number 8. Number 4, number 6, and number 8. 4 is for the shoulder, 6 is for the thumb, and then 8 is for the little finger. And then C5 is area around the deltoid, C7 is the little finger, okay, T1 is the medial aspect of the forearm, and then T2 medial aspect of the arm, and then extends to the axilla. Again, for the upper limb dermatome, C4 is the shoulder, C6 is the thumb, C8 little finger, C5, area around the deltoid. C7 is the little finger. T1, medial aspect of forearm. T2, medial aspect of arm, and then axilla. Now, for the lower limb dermatome, okay, we divide it into three: the thigh, okay, the leg, and the foot. The thigh, the leg, and the foot. Okay, so for the thigh, L1, okay, L1 is the upper part of the front of the thigh. Upper part of the front of the thigh. L2 is the middle part of the front of the thigh. L3 is the lower part of the front of the thigh and then extends to the patella. Again, for the thigh, L1, upper part of the front of the thigh. L2, middle part of the front of the thigh. L3, lower part of the front of the thigh, including the patella. Now, S2 supplies the back of the thigh. The back of the thigh supplied by S2. Now, when we go to the leg, you can see that L4 is the medial side. L4 is the medial side. L5 is the lateral side. Now, for the foot, we have L5 and then S1. Okay, so L5 is the big toe. L5 innervates the big toe, and then S1 innervates the little toe. Okay, so again, you can see L5 innervating the big toe, S1 the little toe. We said that the thigh, we have L1, L2, L3. L1 is the upper part of the front of the thigh. L2 is the middle part of the front of the thigh. L3 is the lower part of the front of the thigh, including the patella. We said the L4 is the medial part of the foot. L5 is the lateral part of the foot, extending to innervate the big toe. Now we'll look at some important trunk dermatomes. Important trunk dermatomes. Okay, T2. T2 is the level of the sternal angle. So this T2, level of sternal angle. Then we'll look at T4. T4 is the level of the nipples. Then we'll look at T7, the xiphoid process. Then we'll look at T10. T10 is the level of the umbilicus. Then we'll look at L1. L1 is the inguinal region. Then for the perineum, we'll look at S3, S2, S4, S5. This is the perineum. Now we'll look at some conditions associated with dermatomes. Shingles. Shingles, it's a viral infection of the nerve roots caused by the varicella zoster virus. Okay, and this causes rash and pain along the corresponding dermatome and follow the distribution of nerves on the skin. Now, it's important to know that anyone who has had chickenpox can later develop shingles because the virus stays dormant in the nervous system. Now, we'll look at cervical radiculopathy or lumbar radiculopathy. Now, when we say radiculopathy, when we have pinching, okay, or compression of a nerve root causing pain, that radiates, that is radiculopathy. Okay, so we can see here. Okay, this is the intervertebral disc. Intervertebral disc. What you see here is the nucleus pulposus. This is the annulus fibrosus. The annulus fibrosus is the outer part. The inner part is the nucleus pulposus. You can see it is protruding or is bulging out to compress the spinal cord and also the spinal nerve. So when the patient complains of back pain that radiates along the level of the thigh, then it means that the patient has a radiculopathy. So radiculopathy is pinching or irritation or injury to a nerve root where they leave the vertebral canal. Now, distribution of the myotome of the upper limb. Now, C5 is for shoulder abduction. Now, the muscle involved is a deltoid. Now, C5, C6 involved in elbow flexion. The muscles involve biceps and brachioradialis. Okay, so this is elbow flexion, biceps and brachioradialis. C6 is for wrist extension. Okay, extension of the wrist. Then C7 is for elbow extension. The muscles involved is a triceps. Okay, wrist flexion. So C7. C8 is for thumb extension and finger flexion. C8, thumb extension and finger flexion. Now T1, this is T1, is for finger abduction and then adduction. Again, C5 is for shoulder abduction, C5, C6 is for elbow flexion, C6 is for wrist extension, C7 is for elbow extension and wrist flexion, C8 is for thumb extension and finger flexion, T1 is for finger abduction and adduction. Now, distribution of myotomes of the lower limb. L2 L2 is for hip flexion, okay. L3 is for knee extension, okay, this knee extension, L3. L4 is for ankle dorsiflexion, okay. L3 is for ankle sorry, L4 is for ankle dorsiflexion, okay. L5 is for hip extension, L5 hip extension, okay. So this is L5 hip extension. Then we have plantar flexion and then eversion, okay. Plantar flexion and eversion, S1, okay. Then we have inversion. Inversion is L4, eversion is S1, and then knee flexion is S1, S2. So you see knee flexion, S2. Now we have deep tendon reflexes. The deep tendon reflexes. For the upper limb, we have the biceps tendon reflex, okay, where we have C5 and C6, but it's mainly by the C5 nerve roots. Then we have brachioradialis reflex, C5, C6, but it's mainly by C6 nerve roots. Then we have the triceps tendon reflex, C6, C7, C8, but it's mainly by C7. Then for the lower limb, we have quadriceps or knee jerk reflex by L2, L3, then L4, but it's mainly by L3 and then L4. Then we have gastrocnemius or ankle reflex by S1, S2, but it's mainly by S1. So this is a summary of all the deep tendon reflexes. C5 mainly, C5 nerve root is for biceps tendon reflex. Then we have C6 for brachioradialis. Then we have the triceps tendon reflex by C7 nerve roots. Okay. Then for the knee tendon reflex, we have L3, L4. Ankle reflex, we have S1. Okay, so we look at the deep tendon reflexes and their root values. Okay, root value for biceps tendon reflex is C5. Root value for brachioradialis reflex is C6. For triceps is C7. Okay. Then for the lower limbs, you come to knee jerk reflex is L3, L4. Ankle reflex is S1.